Have you ever felt your fetus having the hiccups while you're pregnant? Have you ever had someone tell you that this could be a bad sign or a worrisome sign? Have you maybe possibly looked it up on the internet and become maybe concerned or confused? This can be a very confusing topic about fetal hiccups. So let's talk about it. Welcome to the Dr. Lexi Show, where I break down pregnancy topics into simple terms to help you advocate for yourself and your pregnancy. I'm Dr. Lexi, a board-certified OB/GYN and maternal-fetal medicine specialist, which just means a high-risk pregnancy doctor. And today we're talking about fetal hiccups. This is something that many of you may have experienced in your own pregnancy, so today we're going to talk about it and learn a little bit more about it. Data shows approximately 35% of individuals during a pregnancy will actually experience or feel the sensation of fetal hiccups. So before we dive too deep into that, I want to make sure that you're aware of your free download at drlexihill.com/advocate, where you can find a handout that you can print off, take into your doctor's office or your provider's office for your pregnancy, ask some of the basic questions. There are 13 questions that I have there for you to talk to your OB provider about. All right, fetal hiccups. Let's talk about this. So the first thing that we want to do is expanding our knowledge. So we want to learn a little bit more about this. So the first thing I want you to understand is that an adult hiccup is very different than a fetal hiccup. So an adult, when we hiccup, there's like this quick pause. This portion of our throat, our larynx, actually closes off just for a hair of time, just a short period of time. And at that time, there's no oxygen that goes through for that one quick little microsecond, right? That's what I think makes people nervous and worried when they hear that the fetus has hiccups. Remember this, though. A fetus is living inside a swimming pool of its own pee, okay? The amniotic fluid is mainly made up of this fetal urine. They aren't breathing air. They are living in a swimming pool. And the way that they get oxygenated is through the umbilical cord, which is attached to the placenta, which is attached to the uterus, which means it's attached to the person carrying the pregnancy. Okay? So a fetus gets their oxygenation from the umbilical cord, not from air that they're breathing in, because they're not breathing air. So when you hear that a fetus is performing practice breathing, it's just that, it's practice. They're practicing moving their diaphragm, which is the practice breathing, right? Because they're not in an environment of air. So now we've learned that portion about what the hiccup is. The next thing is, well, when a hiccup occurs, what happens? How can you notice it? You can see the baby move. It's a movement of the trunk. If you're doing an ultrasound, you can see this movement. Sometimes a person that's carrying the pregnancy can feel that sensation. Sometimes they can't feel that sensation. So all fetal movements that we can see on an ultrasound, including a hiccup, won't always be sensed or felt by the person carrying the pregnancy. Just an FYI on that. So then a little bit more data about hiccups. How early can a fetal hiccup occur? They can actually start happening as early as about 8 weeks in a gestation. That doesn't mean that anyone would feel the fetal hiccup then. It just means that's as early as they have been documented to have been occurring. So they were seen on an ultrasound. They wouldn't have been sensed by someone that is carrying the pregnancy. So then the question is, when do individuals start to be able to feel sensations of fetal movement, whatever that movement is, a wiggle, a roll, a kick, or a hiccup? We call 20 weeks pregnant the time when quickening occurs. And quickening is the patient being able to feel the movements of the fetus. And so 20 weeks and beyond is when individuals should start feeling different types of fetal movement. Then we get into, well, what happens when the fetus has a hiccup? There can be the sensation of feeling it. Their heart rate can also go up just for a little bit of time. Finally, I want to share a little bit of data surrounding fetal hiccups. So when patients used to tell me that they had fetal hiccups and they were worried, it seemed like they may have done some searching on the internet and found something that sounded concerning. So I did my own literature search to look at fetal hiccups. So the data I could find was supportive in that fetal hiccups were a sign of fetal well-being, meaning and describing that the hiccup is a movement of the fetal trunk. Therefore, we know the baby is moving well, and this is a good thing, a sign of what we call fetal well-being. So nothing in the literature that I could find supported or even said that there was concern for anything bad happening when you feel the sensation or when we see on ultrasound a fetal hiccup. So take home from our expanding our knowledge is that data supports hiccups as a good sign. Then we get into some developing skills. Now that we know that fetal hiccups are considered a good thing, we would need to be able to talk to our provider about movements of the fetus. So anytime you go see your provider, particularly after that 20-week mark, they're probably asking you if you feel movements. That's when you can talk to them about, well, if I don't feel movements, what do I do? And the main questions that you should ask would be, who do I call and where do I go? Because you want to know who to alert with the OB provider's office and what hospital is considered the closest and the most appropriate one for you to go to if you don't feel good movements for the fetus. Be aware that when we see movements of a body part, like a limb for a baby, an arm or a leg, or movements of the trunk, like the abdomen, or the head wiggling or moving around, or the tongue being stuck out and going back into the mouth, those are all signs of fetal well-being. Now, also be aware that not everybody feels all of the movements that a fetus makes. So when you see an ultrasound, even after 20 weeks, you might see a lot more movements than you're actually able to sense or feel. So the percent ranges on which movements individuals are actually able to feel. So every movement a baby has, it doesn't mean that the person carrying the pregnancy feels all of the movements. So perception of fetal movement can vary from person to person. Now that we've expanded our knowledge and developed some skills surrounding fetal hiccups, now we get into the fun part, the impact that we're going to have. You're going to be able to communicate with your provider about fetal movements. You know that they should start some type of fetal movements being sensed at and beyond 20 weeks of your pregnancy. And now you're going to know to ask, who do I call? Where do I go? And that can have a positive effect on your pregnancy so that you know the places to go if you have any concerns during your pregnancy. Thanks for joining me today and learning more about fetal hiccups. I hope that you've learned a lot. And the big takeaway here is that fetal hiccups are considered a sign of fetal well-being. Thank you again for joining me. Don't forget to check out your download for free at drlexihill.com/advocate. Be sure to subscribe to the YouTube channel. And as always, if you have any questions or comments, please leave them below. I'm Dr. Lexi, wishing you a happy and healthy pregnancy.